Around 7.5 million people have now had their first dose of the COVID jab, more than 4 out of 5 of everyone over the age of 80, and many will have had the Oxford vaccine. But German medical authorities now say it shouldn't be given to those over 65 because of a lack of evidence that it prevents the disease. Mike is 71 and has just been vaccinated. His confidence is unshaken.
I'm perfectly reassured by what I've heard from everybody, and particularly my own doctor, who has looked into it and said, you're absolutely fine having this vaccine.
Germany is fighting its own surge in cases, but its public health body, the Robert Koch Institute, has jumped in even before the European medicines regulator has ruled on the vaccine's safety and efficacy and warned against using it in the elderly without better evidence that it protects them. German scientists agree the Pfizer jab is a good alternative.
In this situation where obviously the doubts are there, I guess having an alternative vaccine that has been shown in the trial to work in this group. So I think it's a reasonable decision to say, well, we'll use the functioning vaccine, of which we are at least more sure than this vaccine now.
The Prime Minister, visiting another pharmaceutical company, dismissed the concerns.
I think that the MHRA, our own authorities, have made it very clear that they think the Oxford AstraZeneca vaccine is very good and efficacious, gives a high degree of protection after just one dose and even more after 2 doses.
There is a gap in the evidence. Just 4% of the volunteers in the key clinical trials were over the age of 70, and there weren't enough cases of COVID to prove the vaccine protected more people than the placebo. But lab tests show that older people produce just as many virus-killing antibodies in response to the jab as the young. That was good enough for the UK Medicines Authority and this former drug regulator, aged 77, and another recipient of the vaccine.
I not only believe that I'm protected, I believe that anybody who has had the Oxford AstraZeneca and who is aged over 70 will also be protected, but none of us will be protected perfectly.
Another clinical trial of the Oxford jab with more older volunteers is currently underway in the United States. In the meantime, UK scientists are confident in the rollout. With such a high infection rate, they believe the vaccine will save lives. Thomas Moore, Sky News.